Hi and welcome. I want to introduce today Dr. Lara Salyer, who's with us, to talk about one of the hottest topics of our time, burnout. She is going to come from her own personal experience, but also her experience as a physician and how burnout impacts everybody. So she has developed a holistic functional medical approach with the help of other professionals to address this serious problem that many of us are facing. So thank you so much for being here.
Thank you for having me, Anna. I'm happy to talk all about burnout and creativity. It's wonderful.
Oh, excellent. So let's start by tell us a little bit about your personal story and your personal experience with burnout.
Absolutely happy to. So I like to joke that I'm a physician by day, but a drug dealer by night. And what I mean by that is I travel and get people hooked on the most powerful drug there is, which is creative flow state. And it's the only time that your brain produces all 5 neurochemicals of happiness. And what we don't realize is that is stifled in a lot of our industries, not just medicine. And this is the eye-opening thing for all of us in this pandemic, is burnout is real. It happens in our jobs, in our relationships, in parenting, in just being alive during a pandemic. We're having to use our brain in different ways. And this is where creativity can step in, and with the proper teachings, we can help people learn how to excavate and rekindle that inner muse that they have lying dormant. So my own personal journey is, I'm here in the Midwest in a small rural town in Wisconsin, and I love my little town. And I was wanting to be a rural family practitioner for as long as I could remember. I didn't come from a family of doctors, actually. I came from a family that grew up around a funeral home, so quite different. But enough that I was fascinated with the human body. And as I started my career and with raising 3 young children in this small town with my husband, who's also a family practice doctor, we started realizing that the landscape that we were promised as a career was changing underfoot. And I felt more like a factory worker than a doctor. It felt like my visits were shorter and shorter, and I was less able to do the teaching, which is really the root of the word doctor. It means dotere, which is to teach. And so I didn't quite understand really why. I thought it was the EMR. I thought it was all these different things, right? But burnout is complex. And I think that's the hardest part, is people don't self-identify as burnout. And once I did, that helped me understand what I could do to move myself into the next chapter, which is, I thought I was going to break up with medicine. I thought I was done. I thought I hated it. And it turns out I didn't. I just didn't like the format that I was practicing in. So I just developed my own private practice in functional medicine, and now I'm much happier. And so, yeah, I love to talk more about burnout and what that does to our body and how we can help our audience learn better techniques.
Sure. So let's start by how would you define burnout, and what are some of the causes?
Yes.
Of burnout?
So burnout actually has an ICD-10 code, Z73.0, and it is characterized by 3 things. It's depersonalization, and it's emotional exhaustion, and low perceived personal achievement. So if we dissect that out, it's so different than stress. Stress is like overactive, urgent. We can identify when we're stressed. How many of us have said I'm stressed, and desserts spelled backwards is stressed, right? I mean, it's in our vernacular, it's in our common cultural language. So everybody knows they're stressed. And studies show that things like massages and spa days and vacations help with stress. Unfortunately, burnout's completely different. Burnout is like you have taken your foot off the gas and you're not even engaging. You're in neutral. Your clutch is activated. You are feeling completely disengaged. You're emotionally blunted. And you feel like what you do doesn't really contribute to anything. It's like you could be clocking in and out every day and you're not making a difference. And that's burnout. And see, the problem with burnout is over 50% of physicians are burned out. And burnout is very difficult to self-identify. So you're walking around, and if you're not saying you're burned out, somebody who is, and it's hard to admit to yourself. And
Sure.
These are the people that are at high risk for suicide. So that's why it's an important topic. But it's so interesting because it's so taboo. I think because there is no one linchpin answer to solve burnout, which is why a lot of industries are having a hard time grasping, how do we even tackle this very complex issue? And the way we start is simply with everything that is tricky and sticky and hard to understand, is you just start talking about it. And that's what this is doing, is we're bringing this to the platform as a worthy piece of discussion and understanding ourselves.
So what are some of the causes that that lead to burnout?
Yes. So it depends on the industry. And I've spoken from anywhere from the medical industry all the way to interior designers. They're burned out too, right?
I think that they wouldn't be.
Right. Because they're so creative.
Right.
But really, burnout happens in any place that starts to become automatized. Now, granted, autonomy is one thing. We want our choice. We want to feel empowered. Making things automatic is also a necessary thing. Our brain does this all the time. That's why when we get up in the morning, we don't have to think of how to walk or how to wash our hands. I mean, we're supposed to help our brain become more efficient and automatize certain things. But when you come to a career or a relationship, it is the loss of novelty, the loss of new, the loss of curiosity, the loss of feeling that you do have an opinion and what you say might end up in something different and unique with your own signature stamp. Burnout is that way where you feel like what you do is just no different than what you did 5 years ago or 10 years ago, whether it's in a relationship or a career. And so that's how we get stuck into this corner. And then before you know it, you're confused and wondering how you got there.
Right. So what are the key concepts if we find ourselves feeling that way, like lack of creativity and feeling like we're just kind of going through the motions and all of that? So what are some of the key concepts that can help us recover from that burnout?
That's great. So a couple key concepts are you have to learn to reflect and plan for this routine reflection. And that's why, talking about creativity, about all of us, we are actually creative beings 24/7. We have our alpha brainwaves going and making all this creative, connections and connotations. We just are basically putting a brake on it and we're getting in our own way. But if we allow space to reflect, whether it's gratitude journaling or just noticing a certain period in your day that you have some quiet time to tune into your body. It's a very somatic feeling. And the more we re-engage with our body is very wise and we make very, very good intuitive decisions. And that's the key is the sooner you connect and practice that, good sportsmanship with your body, the easier you'll recognize if you're burned out, the faster you can act on it. And just by doing gratitude journaling or quiet time every day, that's step one is rekindling that awareness of how your body can help you make better decisions. And then the other thing is reaching out. We are isolated, but together, as you know, like social media is the greatest paradox. I mean, we're kind of all doing this parallel, but isolated. And so lots of hospitals are being built without a doctor's lounge anymore. Now that we're all virtual, there's minimal time to really be with your colleagues. And so having this vulnerability, like, piggybacking off of the work like Brene Brown, who talks about the most courageous leaders are the most vulnerable. And physicians are specifically just geared towards being little cogwheels in a big machine. And we need to band together and help each other and make this more of an apparent stake in our future of medical care, because we need to be healthy in order to help our patients be healthy.
So do you think that some of the contribution to it is maybe just the fact that we're constantly on this wheel and we don't really give ourselves the opportunity to just stop?
Yeah. Right. And it's just kind of a method to the madness, right? I mean, as if somebody does choose a career in medicine, they kind of sign up for this. We know it's going to be, you're obviously studying very hard in high school, then you go to college, and there's just little milestones and hurdles that you get used to leaping over. And that's what I discuss in my memoir, my book, Right Brain Rescue. I talk about a very personal journey that is very similar to all people in a medical career, where you keep telling yourself and other people tell you it gets better, it'll get easier. And it really is seeing that it doesn't. And it feels like this is almost like the wool is pulled over our eyes, that when we do sign up for a career, we're signing up for being an employee. I mean, back in the 80s and 70s, physicians had a lot of their own practices, and that's kind of fallen by the wayside, where now we're just an employee. And that's so different when you've worked 25 years for your letters behind your name, and now you want to make some great decisions and run a practice that's your own personality, and it's not as possible as it used to be. So I think the pendulum is changing. So many patients are seeing that they don't want a factory doctor. They don't want a doctor that's tired and slumped in front of them, typing away on a computer screen. They want somebody who's really engaged and is enthusiastic and feels vibrant. And that's basically the person who is excited to be there and has their creativity and their autonomy back.
Sure. Sure. So is burnout something that can kind of come and go throughout your career?
Yeah, absolutely. Absolutely. I think it's a great, especially if you learn to tap into that intuition and how you're feeling and check in with yourself. I joke with myself, my patients, my colleagues, the people I mentor, like, have a state of the union with yourself. We don't have these in our culture. We don't have anything other than when you lease a car. In 2 years, you come back to the table and go, is this car still meeting my needs? Maybe I'll sign up for another 2 years. Why don't we do that for ourselves in our career? Why don't we set times when we ask our partners or whoever's in our life with ourselves, is this still serving me to my highest good? Is this still something I'm really excited to show up every day? And if not, what is it? And sit with that. And the more you even do this on a smaller cycle, like a daily check-in or a longer seasonal or yearly check-in, the sooner you can identify. And I think that's what's hard for a lot of people when they're burned out. They fluctuate in and out of it. Like, you'll have a really tough week and you're like, am I burned out or is it just a bad week? But then the more you keep track of those journaling or that longitudinal look, my bad week ended up being, wait a second, I had this 2 years ago and 3 years ago. It started to be like, wait a second, this is more than just a bad week. And that will give you that empowering fact and data to say, okay, let's extrapolate this. Do I want to be here in 5 years again doing the same thing? And that's when you reach out and you get a physician coach, or there's so many people, a therapist, all these people can help you look at your life in a different way that can unlock things that are blind. We all have blind spots. So.
Absolutely. So how does functional medicine, since that's your area, play a part in the treatment of burnout?
I think it plays a huge part because, like I said, burnout is that spectrum. There's stressed and then there's full on burnout, which is exhaustion and disengagement. So I want to catch people when they're stressed, and functional medicine is amazing. It's the root cause. It goes deep into that biochemistry of how everything speaks to our cells and how our cells talk to each other, whether it's what's on the end of your fork or whatever you're thinking, because your thoughts definitely fuel inflammation and also can be very healing. And what is more healing than creativity? Creativity, they've done studies where they have medical students make things in a creative way, and it helped them, promote resiliency and handle negative feedback and improve. And they've also done flow state work with creativity in surgeons, and they actually decreased their OR time and their patients were healthier. So all these things to tap into this awesome flow state. And when we do that, it actually helps our cells be healthier. So in functional medicine, we go down to that root cause. What is driving inflammation? Because every disease is inflammation in some flavor or form, whether it's inflammation of the pancreas is diabetes or inflammation of the brain is depression. You can label it. And functional medicine doesn't so much care about the label. We want to know why. Why are you inflamed? Do you have an overgrowth of some bacteria in your microbiome? Are you imbalanced in your cortisol? And so what I try to do with all of my talks is explain that deep brain gut connection. As you're stressed, it's going to affect your gut and vice versa. And there's that highway of the vagus nerve. So we talk about what can you do to prepare your gut for a fortified, good immune barrier. Like, are you eating lots of greens that will help with binding to the GABA receptor in the brain for anxiety? Are you taking in probiotics? Are you really nurturing that gut and low sugar, low inflammatory foods? Are you practicing like intermittent fasting to help boost that brain hormone, to help your BDNF quadruple so that you're focused and that you can really have great cognition and sharpness? So that's kind of the hand in hand is, yes, we want to make time for creativity, but we want to give our physiology a good starting chance by being healthy and knowing some of those key foundational functional components.
Sure. So if somebody was to come to see you and say, I feel burnt out, you've identified that that's where they're at. That's the first step really is looking at that gut brain axis?
Yeah, sometimes it depends, right? If they can identify that they're burned out, wow, that's 5 steps ahead, usually the first time people see me, if they're a local patient in Wisconsin, they're seeing me for a bunch of reasons because they're a patient. They're looking to optimize their energy. Most people don't know what they don't know. And so functional medicine gives you that additional deep dive into some testing that we just don't check in an insurance model. So that's where my bread and butter local practice is. But when it comes to colleagues and professional, people that I see, whether again, it's interior designers, police officers, EMS, or doctors, usually they contact me because their institution has asked for a keynote speaker, or they're doing a wellness curriculum, and then they see me and we talk on stage and we go through some of this, checkpoint of your own personal timeline. And it's very interactive. I have people getting up and doing some group exercises and some reflection and some drawing and creativity. And they start to see, after they've been in that seat, that, wow, maybe there's some things I can change really easily in either what I'm eating or my habits or my thought processes. And that begins the journey. And whether we end up in mentorship for their own journey, or, they're able to, read the book and do a book discussion club, it's just a great way to bring this conversation in a comfortable way that doesn't feel so one-sided or up, coming from above of administration. Everyone's a little nervous with their employer sitting there, but when it's a nice, safe environment to just talk about this taboo subject, it becomes easier to digest, literally.
Sure, absolutely. I think that people just need the space, to
Yes.
be able to express themselves. So you hold space for somebody, it can be really powerful.
Absolutely. Yeah. And yourself. And we're horrible at giving ourselves space, right? Like,
Yes.
I mean, but that's what, I joke with people is Pinterest is the best way to get permission. You see everybody having fun on Pinterest, giving permission to play. As adults, we don't play. We don't play at all. And my key grassroots mission is just to say that, let's bring creativity to the platform as the sixth vital sign. Back in 20 years ago, JCO made pain the fifth vital sign, which is weird, right? Because vital signs are supposed to measure how alive you are, and that's temperature, blood pressure, pulse, etc.
Sure.
Pain does not keep you alive. It's a subjective subjective measurement. You rate how much you hurt, and then we plant the seeds for negative psychology. Like, yes, I'm hurting. You need to fix it. So not only have we planted those seeds for patients to say I'm hurting, but then we've set an unrealistic expectation that the key to no pain is looking at your physician. That doesn't work, right? So imagine if we made creativity the sixth vital sign, and every time a patient saw their provider or their doctor, they were asked as part of their vital sign, like, so what brings spark to your eyes? When's the last time you did a hobby? When's the last time you played? And they may not have an answer, but they might reflect back on, wow, it has been a while. And maybe I should dust off my knitting needles or my little drum or my bicycle or whatever. And maybe in 20 years, instead of like an opioid epidemic, we just have like a renaissance of brilliant healers and patients that are super empowered.
Wouldn't that be nice? I think that with the way we live and our just constant responsibilities, that's kind of one of the first things to just be like, oh, I'll let my easel gather.
Yes, because I think people have a mismatch. They think we need expansive space to be creative. Well, I have to wait for that one time I can get away for a week in a cabin in the woods to write my novel, or the big blank canvas that I have sitting in my garage. I need to wait. No, creativity is built in tiny habits. It's in tiny moments where you routinely sit down and go, for every day for 20 minutes, I'm just going to play. I'm going to play and write a story. Or every day for 15 minutes after I get off work, instead of driving right home, I'm going to drive home, but then I'm going to take, some chalk with my kids and draw on my, whatever. It's inviting the uniqueness that you can turn ordinary everyday things and flip it on its head and make them creative. Like, okay, so I drive my kids around. I'm mom Uber. I'm the moober. And so after school, I drive them around, and that's an ordinary event, but you can make it creative. I tell them, okay, you got to get into my car. It's a price surge. And the way you have to pay the fee is you have to tell me one thing that made you laugh today at school. Like that's just something creative. It exercises that fun part of your brain to make it a game. And I think if we invite that, it just makes life more fun. It doesn't have to be so routine.
Absolutely. So let's talk a little bit we talk about kind of creativity and the making space for that and fun things to do. So what about like nutrition and lifestyle changes that can help deal with burnout? The supplements, dietary changes.
Perfect.
Whatever else you got.
Yes, absolutely. So for anybody that's been through medical training, at least for what I was back in the 2000s, is, if you're on call, you're holding your pager and it's 2 a.m., they would open the cafeteria as a treat for all the workers that were third shift. And we go in and we could have some day old sandwiches, usually like a sticky bun or some gross muffin. And what do? We just ate carbs. And that's also just like comfort food for a lot of people that are stressed. And we just load it up on carbs. And that's horrible, right? It causes your insulin to spike, and then you crash, and that also messes up your cortisol, which is the main stress hormone. So no wonder physicians and health professionals are aging at a very rapid rate. There was a study published that showed physicians in the first year of training, they aged 6 years in their DNA. They could measure their telomeres, which is like the plastic end caps of your shoelaces, and they protect the DNA inside. And they measured them aging 6 years. And it's because of all those habits that we have. We're going to grab a big old, double shot espresso with foam and all sorts of stuff. So instead, swap it out, looking at, instead of the muffins and the sticky buns, look at the greens that you can put on your plate that will fuel your mitochondria. They're the ones giving your energy. Look at the good fats like walnuts and eggs that give you choline. Looking at the omega-3s like fish, like just really intentionally planning your plate. And then looking at your sleep habits as best as you can, even just maintaining somewhat of a normal circadian rhythm and practicing bilateral exercise like walking or running or cycling will help that BDNF, that good brain hormone. So there's a lot of things in your life that you can knit together to keep yourself sane during any stressful event. Mm-hmm. And the other thing is just supplements, even the basics. I tell my patients and anybody that I mentor, like, look at yourself. Are you taking in a probiotic, to give a nice variety of a microbiome? They're like little employees of your body. Those little bacteria can help make all your neurotransmitters, your serotonin. Look at, are you taking a good quality multivitamin? Are you addressing your stress with good adaptogens? Now, more than ever, we've got mushroom coffee. Adaptogens are everywhere. You've got lion's mane, cordyceps. So look at what there is around you. And if you're looking for really good guided help, going on ifm.org, you can find a functional provider within your zip code, and just getting that person who can help you make those smarter decisions so you're not just Googling all your symptoms and trying the next fad.
Right, absolutely. So if you find yourself burnt out and you're willing to make some lifestyle changes, how long does it take to recover from burnout?
That's great. And I think that's an unanswerable question. Quite honestly, I think we know that for a fact, every 90 days, you make new mitochondria. You have a whole new generation. And mitochondria are kind of finicky. They're like the teenagers of our body. They're kind of like, sullen. And if they're not bathed in really good anti-inflammatory foods and signals, they shrink. They will shrivel. And you can see that. And they shorten their telomeres. They release oxidative stress. So if you're fueling them consistently, like 80% of the time with good nutrients, good vitamins, about 90 days later, you're going to have all sorts of great new mitochondria, good energy. So physiologically, I would say 90 days is when you can see a huge improvement. But when you talk about how long does it recover from burnout, it depends on what is your unique cause. For me, I thought it was the career. And I was I was searching all sorts of things like medical deposition or writing. I even looked at cake decorating and, all these things. I thought, what can I do for my next chapter? And I thought it was the career. It turns out it wasn't the career. It was how the career was being done. And once I switched the environment and just created my own way, I'm fine. So everybody's a little different in how they recover. And it's a unique question to learn about yourself, which is why it's so important to learn to dive deep into those more uncomfortable corners of your brain and have somebody that is with you, whether it is like, a spouse, a therapist, somebody preferably trained that can understand burnout in that way and help pose questions that might have you think differently about your situation.
Do you think that would be somebody's first step, is to go and speak to a professional about this?
I think so. There's a lot of great physician coaches out there that are geared specifically for physician burnout. And if you're not a physician and you're a nurse, or if you're in any other industry, any certified life coach, even therapists, they are great at asking those interesting questions that we just don't think, and hearing yourself narrate what your answer might be, and then having them pick that apart in a great constructive way can come up with epiphanies you never would have thought on your own. So certainly you can do it yourself, but you might get more bang for your buck with sitting with a professional who can mirror back your experience, and it's worth like months of your own journaling. So I always advocate, like I tell my patients, I think everybody should have a primary care doctor. Everybody should have a good therapist in your back pocket. You never know. And they're great at asking those tough questions.
Absolutely. Absolutely. And also accountability. I think.
Absolutely, because you know what, you feel kind of funny going back every time, and then they ask you, so how'd that go, and how you doing there, and you haven't done your homework, and it's not about doing something wrong. It's just about you are there to go at the pace that you're comfortable with, and so are they. They're there to meet you right where you're at. And I think that's what physicians, I know I bristled at first when I realized I was burned out. I did it at a conference for wellness, and it was a conference about burnout, and it was a bunch of us in a room, all different ages, different timelines of medical careers, and we all didn't know we were burned out. We came for wellness, and it turns out as we go through the curriculum, we left realizing, oh my gosh, I think we're all burned out. And that's when my journey started. Well, now what do I do? I've identified this. Now where do I go? And that's when I partnered with a physician coach. And in just a few sessions, she was able to get me to ask some good questions about my core values and what ideally I would like to be doing. What is my zone of genius? What skill set do I have? I think a lot of us worry that we've spent all this time and money and we can't do anything but this. No, there's a lot of skill sets you can transfer to other occupations. And so that's the beauty of partnering with somebody who gets it and can help you navigate. So yeah, I would say sooner than later, we bristle at the word coach. Like doctors are like, we don't need a coach. I've lived my life in this body for so long. I don't need help, but we do. We need help. We're human. Nobody has all the answers. And so reach out and get people that can help you.
So how is this, let's say I went to just a traditional doctor and I said, I'm feeling tired and unmotivated and maybe experiencing burnout. How would their approach maybe be different from this particular approach?
I love that question because I am not anti conventional medicine. I mean, I am a board certified family practice doctor, an osteopathic physician, and went through residency, and I love my career, but we're trained in a certain way. So a traditional doctor would probably do a thyroid test, do some bare minimum. How's your sleep? How's your menstrual cycle? If you're a woman, how's your relationships? They might dive into that, but let's be honest, they have 15 minutes. So they're going to ask those quick questions, and then they'll probably refer you to a therapist, hopefully, because there's no shame in that. I think everybody should have a good therapist. And then hopefully they might offer some ideas. Well, make sure you're eating healthy, eat more protein, make sure you're exercising, but they kind of throw this out at you. I remember I was one of those doctors just kind of throwing out everything like, don't eat a lot of sugar, try and limit your caffeine. Like some of these low, yeah, right. Like you're just trying. And then as far as vitamins and supplements, we're not trained. I'll tell you that firsthand. Being an osteopathic doctor, we're very holistic, but we aren't trained in good nutrition or supplementation. At least we weren't back in the 2000s. And now we're limited. You can't really do much. You're basically limited to an SSRI medication. Here's your Zoloft. I hope you feel better. Go find a therapist and I'll see you in 3 months. And that's exactly what happened. Mm-hmm. Because we don't have time to deal with a lot of these questions. So in my new way, in functional medicine, as well as a lot of the colleagues that I talk to, they've created a new world where we can spend that time. My first visit is a whole hour with a patient, and they get to talk to me directly in the portal. And we talk about, okay, this is the next supplement that is the smartest for your biochemistry to do, and then we can talk about this testing. And so it's like a user manual. It's like people come in for their 100,000 mile checkup, and this is a quality checkup. You're getting a lot of information. And so it's not that the medicine is bad. It's not that prescriptions are bad. It's just that I think you need both. And I think having our good primary care doctors on the front line, they're doing great work. My husband's a primary care doctor. Some of my best friends are primary care. We need them, but it's not the answer to everything. And having a functional perspective is really helpful for those people that really want to optimize how they feel.
Absolutely. Absolutely. So what are some of your final thoughts about burnout, preventing burnout, recovering from burnout, or anything else you can?
My final thoughts are, if you think you're burned out and you're wondering, you probably are. And it's okay. And it's not a shameful thing. And I think it's awesomely brave and vulnerable to admit that you suspect you might be burned out. And the first thing you should do is just sit with that. And it's uncomfortable, but sit with that and maybe journal. If you aren't a pen to paper kind of person, then journal in an electrical way, either a Google document, a digital method that you can reflect on your own circumstance, sometimes setting time in a calendar just to remind yourself to think back on that question. You can use Google Tasks and be like, I'm going to ask myself in 2 weeks, how am I feeling? And that might be just enough to trigger. 2 weeks went by and you're like, oh my gosh, it's the same. I thought it'd be better by now. Having these moments of reflection are so key. and then reach out, look at the services out there. There's a lot of people that want to help you. Usually a hospital or institution, whether even if you're not in medicine, they'll have some kind of an employee assistant program. So utilize them. They might have coaching. They might even have therapy that is already paid for, that you can utilize that. So again, no shame. It's much better to be vulnerable and to learn what you're needing, because this is your life and you want to be as creative and vibrant as possible, and dust off some of those hobbies. Studies show that the benefits are long-term, is directly proportional as how long you're playing or in the zone or creating. You actually will benefit for days later. And absolutely reach out to me if you ever want anybody to come to your institution to give a really fresh and innovative way to talk about this, either in a speaking or keynote. drlarasalyer.com is where you can find me. And if you want to just laugh and learn about motherhood and funeral homes and all this kind of burnout and bliss and creativity, you can read my memoir, Right Brain Rescue, and it's available on Amazon.
Perfect. All right. Well, thank you so much for your time. This has been, I think, really necessary with this year that we've had.
Absolutely. Oh, one last final thought, Anna. Here's a fun thing. You could have your whole family do this. I had my family do this. I have my patients do this. Take a picture, a blank piece of paper, and have you or your patients or your family draw themselves, ideally a year from now, and draw 10 minutes, draw, and then you lock it up in a time capsule, and then you open it up a year from now and see how close that is. For patients, I do that at their first visit. I want to know, it'll tell me all the things they're thinking. And it's really cool to see how detailed they are. Like one lady had a bunch of little tiny mini toilets in the background. I said, "What is this?" And she said, "Oh, I don't have to count toilets anymore because I feel better. I'm not having bowel issues." And another person was hiking on a cliff, and another person was playing with their grandkids. So all of this world can be yours. And when you draw it out, you're making these microscopic decisions like a vision board. And that can help align all your future microscopic decisions to live the life that you really want to. So thank you for this opportunity to spread a little bit of this creative sparkle. And I hope everybody starts coloring outside the lines.
Absolutely. Me too. Thank you so much.
You're welcome.